Environmental Health Network. And I've been with the group for over 2.5 years now. So I'm excited to keep working with amazing advocates and health professionals and environmentalists still today. So a little background on who WEN is, which is the Wisconsin Environmental Health Network. Well, WEN is a group of advocates, health professionals, general people concerned about health that are trying to advocate for change to make this a safer and cleaner Wisconsin for all of us. We provide various talks. We held our annual conference, which this year is going to be a series with 4 amazing people, Arlene Blum, and now I'm going to blank on everyone, but Arlene Blum, Leo Tresande, Linda Birnbaum, and Christine Till. And you can find out all about them on our website and the amazing research and amazing advocacy things they've done when it comes to environmental health. So that's the plug for our event coming up in February and March. And the other place I want to kind of give a little bit of background is our sponsor, our partner for tonight's event is the Wisconsin Health Professionals for Climate Action. They are a new group of health professionals, nurses, public health workers that are teaming up just to fight climate change and come together and declare it a health emergency. So they're our partner for tonight's event, and Abby is the staff member there. And many of the other people here I know are also part of that group. So those are the 2 basic intros there. And then I want to introduce our 3 speakers for tonight. So first we have Susan Davidson. Susan, can you give everyone a wave? There we go, there she is. And Susan practiced maternal fetal medicine at St. Mary's Hospital Medical Center. She's still an adjunct professor of OBGYN and family practice. She's also the board president at Midwest Environmental Advocates. So that's a little bit about her, and she can always add on more about herself. Next, we have Beth Neary, who's a clinical adjunct assistant professor of pediatrics. She's also the Wisconsin representative for Pediatric Environmental Health Specialty Units, also called PESHUs. And she's also a member of the Council on Environmental Health of the American Academy of Pediatrics. And then last but not least, we have Claire Gervais, who is a clinical associate professor with the University of Wisconsin Department of Family Medicine and Community Health. And she's still a practicing clinician, and she's also one of the founders of the Climate Action Group that I mentioned earlier. So those are our speakers, and that's about who we are. And so now we'll turn it over to get the presentation started. A few housekeeping rules. You're welcome to share your video to see faces, but if you don't, that's okay. In the upper right-hand corner of Zoom, you're able to change your view if you want to see gallery or you only want to see the person speaking. And right now we have everyone muted, and we're probably going to keep it that way so we can hear our speakers until the questions at the end. But you're able to submit any questions you have in the chat box at the very bottom in the center of your Zoom screen at any time, and we'll keep those. We can answer them throughout and then also at the end of the presentations. So those are a few housekeeping rules. So now I'll turn it over to Susan, who will be presenting first. All right, there you go. We can see it. You're all good, Susan.
Okay, wait a second. I need to move. There we go. All right. Well, welcome everyone and good evening, and what a pleasure to be here with you. So I'm going to start by, we're going sort of through the life cycle here. So I'm going to start with pregnancy because I am a maternal fetal medicine specialist. I take care of fetuses. I'm a fetal doctor. And then it's going to move to Beth, who's a pediatrician, and then Claire, who sort of does it all, is going to be our wrap-up person. So I'm going to start by talking about the environment and pregnancy. And at birth, who we are is this really complex interaction between our genetics and our intrauterine environment. So we have a genetic environment.
Susan, you just got muted, by the way. There you go.
Okay. Did you hear anything?
Just a little bit.
Okay. So at birth, we are a complex interaction of genetic, a cat joining me, and our intrauterine environment. We have our genetic endowment, we have our environmental exposures, how our maternal nutrition, maternal stress, overall maternal health, and that contributes to who we are. We're really very multifactorial. Let's see if I can get it. Now, I am going to argue, because I'm an obstetrician, that pregnancy is the most important time, and Time magazine agrees with me, because they say the first 9 months of your life, the intrauterine environment, shapes the rest of your life. And this is a really burgeoning field called the fetal origins of adult disease. And things like cancer, high blood pressure, obesity are somewhat determined by what happens to you in utero. So this is a very, very important time. Now, not only are we multidimensional and determined by very many things, but it's a cyclical kind of thing. Somebody called this the obstetrician's karma wheel. But we have our genetics and our intrauterine environment, and then that interacts with our psychosocial environments to determine who we are, and that affects our own pregnancies, which affects our children, how they come out. And so what happens to us now can potentially affect our grandchildren. So this is not just about one stage of life. This is really about the cycle of life. So we're going to talk about chemical exposures, and we are, since World War II, the amount of chemicals that we've been exposed to are huge, and most of it is very untested. We don't really know the safety of most of it. We know that pregnant women we all carry many, many chemicals in our blood, and this is a sample of pregnant women, and what they find in the blood of pregnant women are pesticides and solvents and heavy metals and plasticizers and, excuse me, I'm arguing with a cat.
Susan?
Yeah.
Susan, one thing is I don't think we're on the same slide as you.
Does it say chemicals in pregnant women in the United States?
It does not. It says the environment and reproductive health, why what we eat, breathe, and touch matters.
Oh.
So maybe reshare or go down further or click where you're at.
Well,
also, I think you need to be on the other mode instead of on the presentation mode.
Yeah, yes, presentation mode.
okay. I'm going to stop share. Okay, what mode do I need to be on, and how do I get there?
So share your screen again with that presentation. Yes, that looks great. It says chemicals in pregnant women in the U.S.
Yes, okay.
That looks great. That looks
Sorry.
perfect. Thank you.
Okay,
Sorry.
thanks for telling me. Okay. All right. So this is what they find in the blood of pregnant women. And actually, this is in the blood of all of us. Now, we used to think that the placenta protected the fetus from exposures. And years and years ago, they said, oh, the placenta blocks out everything. Well, that's not true at all. It turns out that what the fetus sees is exactly what we're made up of. So the placenta is quite permeable and does not protect the fetus. So when they look at what is actually in newborns, you can test the blood of babies at birth. You can get a sample of the cord blood, which is the blood they had as fetuses. They tested for 413 chemicals, found 287 chemicals in the average newborn. In newborns, 200 was the average they found in newborns, and these are carcinogens and developmental toxicants, and we don't even know what the combination of all of this does. So we do know that there are critical periods for environmental sensitivities in human development, and these are times when cells are rapidly dividing. So fetal life and neonatal life is a time of rapid division. All through childhood, as Beth is going to talk about, puberty and pregnancy are particularly vulnerable times for exposures to toxicants. So I'm going to talk about a little more specifically about 4 different toxicants. That's lead, mercury, nitrates, and endocrine disruptors. Just to give you a smattering, we can talk about this forever. We can talk about this for an hour and a half, but these are just samples of some big ones that we encounter in Wisconsin. So the first thing I'm going to talk about is lead. And about 1% of women have too much lead in their body to be safe for pregnancy. Unlike children who there's actually quite a higher rate because they're mouthing everyone, it's not, lead paint is less of a problem for pregnant women, unless you happen to be renovating or remodeling an older home. But recent immigration, people use traditional cosmetics, people who are iron deficient or vitamin D or C or E deficient, people with occupational exposures are at higher risk for having higher lead levels in their pregnancy that can affect their fetus. So how does that affect the fetus? Well, the lead crosses the placenta. It's detected in the fetal brain as early as the first trimester, and it's also, high lead levels are associated with an increase in gestational hypertension, in abortion, spontaneous abortion, miscarriage, low birth weight, and the big thing is impaired neurodevelopment. Lead is a very potent neurotoxin. And I think Beth is going to talk more about that in children. So is this a problem in Wisconsin? Yes, it is a problem in Wisconsin. And these are the areas of Wisconsin where there are dangerous lead lines. Biggest one is Milwaukee, Racine, Manitowoc, Kenosha, and Marathon County. But you can see it's really spread all over Wisconsin. So lead exposure in pregnancy and in childhood is quite a current problem. So how do we find out about this? Well, you can use a screening method on your patients in clinical practice. And here's one that's commonly recommended by the Minnesota Department of Health. And you go through these questions. And if anybody tests positive on the questions, you know, do you have a house built before 1978, which is really common in Wisconsin, and everybody's always renovating. So these are things that might spur you to get a lead level in Wisconsin on your patients. And these are neurotoxin, and we get mercury primarily by eating fish. It's given off by industrial pollution, which is then the mercury goes into the atmosphere. It goes into the waters, the fish eat it, and it kind of goes up the food chain. So bigger fish have more mercury than smaller fish. We eat the fish, and then it affects brain development. Now, there's lots of data showing that actually the offspring of fish eaters do very well and have higher IQs. So we do encourage eating a fish that has optimal omega-3 levels and low mercury, such as wild salmon, sardines, mussels, rainbow trout, and Atlantic mackerel. I once did a survey on what is in a Wisconsin fresh fry, and none of these are in it. Too bad. I'm going to direct you to the Wisconsin Department of Natural Resources has a really wonderful guide, Choosing Wisely, which is the guide to fish eating in Wisconsin. They update it every year or two. Here is the link. And after this talk, we're going to post all the links in the chat so you can get to them. But this is a really wonderful resource to share with your patients, with whoever you're taking care of. So the next topic I'm going to talk about is nitrates. And 30% of Wisconsin residents use private wells. There's no regulation on private wells. You don't have to test them. It's not required. 70% of Wisconsin residents get their water from groundwater. So even if you have municipal water, especially in central Wisconsin, that can come from groundwater, which is very susceptible to nitrate pollution. 10% of the wells have nitrate levels above 10 milligrams per deciliter. Almost all of the nitrate in water is from agricultural sources, and it's the most, nitrate is the most potent groundwater, common groundwater contaminant in Wisconsin. So why do we care about this? Well, the most obvious thing is methemoglobinemia, which is blue baby syndrome, and that occurs at nitrate levels at around 10. We see very little of that, actually, but the more we know about nitrates in water, the more we know about the health effects. And a big paper just came out on health effects in Wisconsin. Nitrates are associated with neural tube defects and low birth weight, preterm pregnancy, colorectal cancer, kidney, bladder cancer, ovarian cancer, thyroid cancer. And of most concern is these health effects are seen at levels below 10. They're often associated with levels of 5. So this is a very serious issue. And a recent paper just estimated that the direct medical costs of taking care of all these things per year is $23 to $80 million per year in Wisconsin. And these are just the direct costs. This is not the cost of time away from work and things like this. So nitrates are a real issue in Wisconsin. What do we tell our patients? Well, one thing is that the state recommends that we test wells yearly. Unfortunately, it's on the person, it's on the well owner to test. They're done privately. State Lab of Hygiene offers a nitrate test for $30, and you can also look at the various private companies. There's a website, Wisconsin website on regulated labs, unaccredited labs that will do this. And there is a little bit of state money if you meet certain kinds of criteria available for remediation. So if your patient goes, well, what am I going to do? You know, how am I going to fix this? They can get some money potentially to help them fix it. And then the last thing, which is a huge topic, is endocrine disrupting chemicals. These are the big 12 of the bad chemicals that disrupt our endocrine system, often our thyroid system or our sex hormones. This is a mixture of flame retardants and solvents, plasticizers, pesticides, heavy metals. And this is kind of bad news for all of us because the health effects are myriad. Breast cancer, testicular cancer, developmental problems, infertility, decreased sperm count. So one of the things that's most interesting to me is obesity, because there's evidence that these are obesogens and they actually tell our fat cells to become, the pre-fat cells should become fat cells, and then they tell them to become fatter. So these endocrine disruptors are quite concerned. And you know, this always gets people attention. These are sperm counts of men since 1970. They are plummeting. And it's really felt that the reason they're plummeting is because of exposure to endocrine disruptors. So what do we tell our patients about this? These next 3 slides are a tool that's on our WEHN website. So I direct you to it. It's both a tool for you to use in practice and to give to your patients because it's an educational tool. So what I want to emphasize is that pregnancy care is care of the woman throughout her life. It doesn't just start at pregnancy. It started with her mother's pregnancy, and it starts in how you do during your pregnancy starts in when you were in the womb and through your childhood. And so it's really a lifespan kind of care. Remember, 50% of all pregnancies are unplanned. So if we wait to take action before somebody actually presents for care, we've already missed the boat. So pregnant practitioners taking care of girls and women should reinforce healthy habits. They should ask people about pregnancy plans. Do you plan to become pregnant? Would you like to be pregnant? If you wouldn't, what are you doing not to be pregnant? And for every single woman of reproductive age, they should be taking 400 micrograms of folic acid a day in a multivitamin because that helps prevent birth defects. So I put this in every talk I give. So I have some websites to tell you about. One is Mother to Baby, which is the organization of teratogen services. If you have any questions about how something affects a pregnant woman or a child, you can go there. This is our website. And then the University of California at San Francisco has wonderful handouts called Toxic Matters. And they're very patient-friendly, 8th grade reading level handouts in both English and Spanish. So we're going to post this soon on their chat, so you can get to those. And then finally, I'm encouraging everyone on this call to become a policy wonk, because it's not fair to put it on individuals to have healthy habits. Providing a healthy environment for ourselves and our children is all of our responsibilities. It's a societal responsibility. And individual choices can only go so far. So I encourage you to use your position and your expertise to influence policy. So thank you for listening, and I'm going to hand this off to my beloved colleague, Beth.
Thank you, Susan. We appreciate that so much. And if people have questions, you can put them in the chat, and then we'll answer them at the end. The floor is yours, Beth.
It says I can't share when the others are sharing.
Cancel your sharing, please, Susan.
Stop share. Okay.
Got
Does
it?
that do it?
Yes.
Okay.
All right. Now I can share. Okay. Okay. So I'm going to incorporate environmental issues into clinical practice, and how do you do it? So why is it important to educate yourself on environmental issues and incorporate it into your practice? Basically, environmental issues are tied to health. So it'll help you diagnose and treat exposures, but it'll also give you opportunities to prevent diseases. Clinical medicine really needs to be linked to community and public health. We've learned that now in the COVID pandemic more than ever. And it's also, I'm going to reiterate what Susan said, it's important to advocate beyond the clinic for your patients and highlight some environmental justice issues. Bottom line, too, is the patients expect you to know, and they'll ask you questions. They'll be on the internet and they'll get a lot of misinformation, so we need to give them the proper information. So as far as children are uniquely vulnerable. They are the canary in the coal mine for most environmental toxicants. I'm going to tell you the value of an environmental history, talk about environmental justice and the impact of public policy, give you a couple of specific examples and some credible sources. So why are children more susceptible to environmental toxins? Well, a number of reasons. They have unique exposure pathways, they have different absorption and metabolism, they are shorter, they have different living zones, they're closer to the ground. So if there's a pesticide in a lawn, they would be more exposed. They could be crawling on it. They're lower down and they breathe things that might be coming off a carpet or something. They have exploratory behaviors. They put things in their mouth that they shouldn't, but they're in a rapid state of growth and development. And because of that also, there are critical windows of susceptibility during that development, and they have a longer lifespan. So here's a case, and just to, there's a previously healthy 40-year-old that presented to an ER in Minnesota. Symptoms were pretty vague: headache, abdominal pain, fatigue, weight loss, irritability, elevated blood pressure. And an ER doc did the complete history, including his occupation, figured out where the person worked, and based on that history, he ordered one test that made the diagnosis. He actually ordered a lead test. The person worked at the Fraser shipyard. And as a result of that one doctor asking that question or ordering that test, they were able to help 170 Fraser shipyard workers when they did an investigation. So one led to 171, because many of those people may have just ignored the symptoms or not gone to their physicians. So it had quite a big impact, just asking a good history. So here's how you ask a good history. And I like this one because I find that acronyms help me remember things. So the way I remember that is ACHU. So activities, workplace, and this is for a child, but it could also work for an adult, where you spend your time. What's going on in your community? Is there a source of pollution that people are facing in that community? For example, people in Marinette, Wisconsin right now are facing PFAS contamination of their water. What's going on with the household? Is it an older home that the person might be exposed to lead? What are the individual hobbies of your patient? If your patient works with leaded glass, do they shoot and use lead bullets, for example? What's their occupation? And knowing the occupation of all of the patient's parents and the patients themselves, I think, is a critical piece of information that should be in every chart. And what's oral behaviors like diet is important. So people are already incorporating environmental health into their practice right now because with lead screening. So lead poisoning still is a statewide problem. As you can see, that every red dot here represents a child that was lead poisoned since 1996. There actually should be more dots on there now. But it's statewide. It's not just Milwaukee and Racine and Green Bay. Here's the summary of why now we don't accept any level of lead in the body for children, is that we found that at very low levels, meaning less than 5 micrograms per deciliter, there were significant impacts on the brain, resulting in decreased IQ, decreased academic achievement, increased incidence of attention-related behavior, and what we call executive function, the ability to sit still and pay attention, which then affects the child's ability to do well in school, has impacts on their reading scores, has impacts on high school graduation, which leads to the jobs that they can get in life. And there's actually some studies that correlate lead levels to incarceration levels. So it has great impacts for a person's life that we can intervene early on and make a difference. So here's where I want to emphasize why regulation really makes the big difference. So I'll just walk you through the slides. So the pink dots represent what the CDC thought was lead poisoning. Can you see all of that, or are the faces showing? No? Okay. So in 1965, we thought 60 micrograms per deciliter was lead poisoning. It certainly was, but it was way too high. But over time, with more research, we now know, as you see the pink dots coming down and down and down, and it should go all the way to 0. We actually still use 5 because that's called a reference level. It's as low as we can sort of evaluate it in blood. And then compare that to the green dots, which represent the average blood lead level of children in the United States. And between 1980 and between 1990, there was a significant drop there. And that was related to one piece of regulation, which was taking the lead out of gasoline. So policy makes a big difference. I want you to know that paint is still the primary source. And the older the home, the more the lead hazards. So we learned from Flint the issue with lead in pipes, as Susan was talking about. And here's where the problem is. It's called the lead service line. So when the water comes down the water main's fine. It doesn't have any concerns with lead. It's this service line that goes under the sidewalk, under the grass in front of your house, right before it gets into your home. And the problem with it has been that half of the line is owned by the municipality and half is owned by the private owner, and that's been the holdup in replacing these pipes, because you actually have to replace the entire pipe. But the good news is Madison was the first in the nation to replace all of those pipes, and in 2018, Governor Walker actually signed legislation that allowed municipalities to finance the replacement of their lead service lines, and I can report that Green Bay actually just took out their last service line on October 6th, 2020. So good things are happening. I put this slide in because I want to emphasize to physicians that how important it is to continue to do the lead test at 2. Oops, I went backwards, sorry. We find that less people are doing it at 2. They're sort of doing the 1 year, kind of dropping off at 2, and it's really important to do at 2 because that's when the highest incidence of lead poisoning is found. This is some data from the state, and as you can see with the dark bars represent 10 micrograms per deciliter when we thought that that was the level that was quote unquote safe. But in 2012, the CDC changed it to 5 micrograms per deciliter. And that's where you see the bar graph go higher when we thought we were doing well, but we changed the parameter based on newer research. So we still have work to do in this state. And here's the impact of COVID on what's happening right now. Is because of COVID, we are not testing children as much as we should, and therefore we're not identifying children who are lead poisoned. So COVID has impacts beyond COVID. The key points are lead is still the most significant preventable environmental health issue for children. We need to screen and test at-risk women and children, testing at 1 and 2, and the real goal is primary prevention. We need to get rid of the lead service lines, and we need to improve the properties so that people are not being exposed to the lead in their homes from the paint. and advocate for policies. This was in the New York Times just a few months ago that showed that Black Americans are 75% more likely than others to live near a facility that produces hazardous waste. So what we need to do is speak up for those who can't speak for themselves. So poor children, poor people in general are affected more than anyone else, and we need to advocate for them. Whoops, that's not okay. So then I just had another case I was going to present, trying to convince you that this is an important thing. It was a child who was doing well in school in 3rd grade, but when he hit 4th grade, he couldn't do basic math. He couldn't read, whereas the year before he was able to write short stories. It just was a dramatic change in this child. And then the mom noticed that he couldn't catch the football as well. And the doc did a really good environmental history. And in the environmental history said, well, how's the child's diet? And the mom said, oh, he's so good. He doesn't even eat junk food or anything like that. You know what he does? He eats tuna fish every day. Ding, ding, ding. The child had mercury poisoning. So I know Susan spoke about this, but how much fish is safe to eat? Can a pregnant woman eat it? And what's so good about it anyway? And my kid likes tuna. Can they still have it? So based on that, yes, you don't want to eliminate fish from your diet. It's a great source of protein, B12, omega-3 fatty acids, selenium, zinc, and iodine. How much fish is safe? The FDA actually has guidelines. When the case that I gave to you, there are actually no guidelines, and the mother was very upset because she's like, how am I supposed to know this kind of stuff? So all the more reason that we need to help our patients understand. So an adult is supposed to have a pregnant woman, a maximum of about 8 ounces a week. And then for children, for age 2, it's 2 ounces. Age 6, it's 4 ounces. Age 9, it's 6 ounces. And then if you hit 11, you can be at an adult dose. Just a couple of points. If your patient does eat tuna fish, advise them to go for the light rather than the albacore. The albacore has higher levels of lead. And as Susan showed you, here's the cycle. And the main reason is coal-powered plants. And you saw this slide with Susan, and I'm going to show you it too. It's better to talk about the fish they can have rather than the fish they can't have. So these 5 are good ones, but if you're going to have the tuna fish, like I said, go with the light tuna fish instead of the albacore. And if you have a patient that really likes fish, they can research it a little bit more. This is the New York one, but we have one in Wisconsin too. And if you have somebody who's what's called an angler, that means they fish a lot, they really need to research where is a safe place to fish so that they can look at levels of mercury and PCBs. So what if you could ask one question in your clinic and prevent cancer? Would you do it? And everybody would say, of course I would do it. Okay, here's the question. Have you had your house tested for radon? So here you can see that lung cancer related to radon, that was non-smokers, was a significant source of cancer and mortality. And this is older data, but I think it still holds. Radon occurs naturally. It's in 1 in 5 Wisconsin homes. Testing is easy and fairly cheap, and mitigation to fix it works. I'd love to see something in every chart where they say, was your home tested? And if we could do this for everybody, it would be wonderful. How does it get into your house? Well, it gets in through the cracks in the soil, up through pipes, up through cavities in the walls. And the test kits, there's a variety, but you can buy them at the hardware store, set them up in your house for 72 hours, mail it in. And the ideal time to test is actually January because the houses are all closed up in Wisconsin. And the public health department actually does a big push in January. Please test your home for radon. So, and here's what you do. You mitigate it by taking the air out of the basement. So there's a sensor that senses when the radon level is higher, and then it kicks in. I hear my neighbors going off all the time. And just to let you know, my level was okay, hers was not. So even in the same neighborhood, you can have different levels of radon. And here's the other reason I said patients are going to ask you questions, so you need to know information to answer their questions. So you're going to hear a lot about PFAS, and it was actually on NBC News tonight talking about it. There's 5,000 chemicals in the class. It's in our Teflon. It's in our water-resistant shoes and water-resistant coats. It's in firefighting foam. It's in the slick lined boxes that you bring the pizza home with, although I've noticed lately that the pizza place I go to doesn't use it anymore. It's the regular, so good. It's persistent, it bioaccumulates, and it's linked to many health effects. These are PFAS contaminated drinking water sites nationwide that are in blue, and in purple are the military bases, which are also at risk because they use the firefighting foam. And even though it looks like North Carolina, Michigan, New Jersey, and have the worst, it's just that they're looking, so they know where it is. Maybe these other states haven't looked as aggressively. I know that Michigan has been very aggressive in evaluating their water. So a good thing to watch would be this movie, Dark Waters, because it goes into the details of the health effects. It was a case that was in West Virginia that was made against the DuPont, who had a Teflon plant there, and they actually won the case. And as part of the remediation from the case, they actually did a study called the C8 study. And in that study, they looked at patients in advance. And as they were contaminated, it looked at what diseases came about. And it was a pretty significant study. So it's worth watching the movie. It's kind of fun. And it's happening here in Wisconsin. So the firefighting foam that's actually made up in Marinette, Wisconsin, has contaminated a number of wells in the area. So it's quite a big issue here. And even in Madison, we've had to close one of our municipal wells, well 15, which is right by the airport, because of contamination. So you'll hear more about this. So your patients might ask you to do a blood test. That's a bit controversial based on exposure, just because we know that 95% of us have it in our blood. We don't know what to do with the levels. We don't know what it means. And so there's a lot of controversy with whether or not we should order an expensive test when we don't know what to do with it. So I think the best thing to do is to talk to your patients about ways to eliminate it from their water. And some ways to do it would be the reverse osmosis filter, and the two-stage filters take out a significant portion. And even the activated carbon at least removes about 73%. Those are the kind of questions you might get in clinic. So here's some sources of information. And this is about the pediatric environmental specialty units. And these two schools have really good websites, Columbia and Mount Sinai. And I go to those for pediatric information. And so in summary, I say the role is to educate, prevent, connect, and advocate. Thank you.
Thank you so much, Beth, for highlighting some of those really important issues and bringing it home to Wisconsin. Definitely appreciate that in your time. So now we will move to the next stage of life, pretty much, with Claire. And Claire will share her screen, I think, and the floor is yours.
Sounds good. Let me see if I can get my presentation up here for you.
And again, if people have questions, you can send them in the chat. Abby and I are trying to answer them as we go, but we may ask at the end our three fantastic speakers some of the same questions and see what they have to say.
All right, we're going to talk about integrating climate change into patient encounters. And I only have 15 minutes. I'm going to probably go a little bit over, but I could give a whole nother talk on climate change and health. I realize I haven't really, I'm not going to be focusing on that for this talk, but I'm assuming that a lot of you have engaged in talks like that. So we'll get started on what our objectives are. So we're going to talk about why it matters that clinicians are involved now, what some of those barriers are in our clinic to discuss climate and health, and then opportunities for incorporating the education into the office visit, and I'll mention some resources at the end. So why should we be involved now? Well, the health impacts of climate change are happening now. And it's really an equity issue, as are all environmental health issues. Those that are most impacted tend to be, people that live around like coal-fired power plants, or, in areas that, there's more heat in the city. Some people are more affected by flooding, but yeah, there's different groups that are more affected than others. And as clinicians, we are some of the most trusted voices. We'll get into that a little bit more. And then I feel it's a kind of a professional duty, in a sense, to be involved in this significant public health issue.
Sarah, do you have slides or not?
You're not seeing my slides?
No, I'm not.
Oh, I'm sorry.
It's okay.
Okay, yeah, I can see them. Let me go out of my presentation for a moment. Sorry about that. I thought I had shared my screen properly. Okay, I'll try that again.
There we go.
All right. Well,
perfect. Great.
I think I read it. I think I read everything up to this point. So anyway, we'll go from here. So it was, I watched this presentation by National Academy of Medicine President Victor Zhao, and I've seen this other places. Really, year 2020, the year we're just ending, is, he called it the year of the triple threat. We're dealing with so much this year, climate change being one of them. And these are all rather related. The COVID pandemic, of course, and systemic racism. These are all things that are interrelated and that we have to deal with and address because they're all threats to public health. So, here's I just saw this, I think yesterday, and I had to put it in my slideshow. Just the year of stormy and fiery events and this just illustrated all of the hurricanes we saw. I'm lucky enough to have a scribe but she's from Louisiana and from Lake Charles. And you hardly heard about Hurricane Laura up here, but this hurricane landed smack dab to Lake Charles as a Category 4. It was even a larger category than Katrina, and we hardly heard about it up here. I think because Lake Charles is a much smaller community, but just basically wiped that community out in August, and it took her 6 weeks to get back to work. And then they were hit again in October by Hurricane Delta. It was just crazy, 2 major hurricanes in the same location. We were just seeing unprecedented storms this year, not to mention all the fires, which kind of goes to my next slide. Here's an example of a wildfire in California. Well, California gets hit quite a bit. I mean, this slide this picture is from 2018, but there was, a significant issue with fires in California this year as well. And in the western part of the country, we see this a lot. But this slide is mostly to illustrate the IPCC, which stands for the Intergovernmental Panel on Climate Change, their 6th report, which says if we don't do something now, or within the next 12 years to significantly reduce our carbon dioxide emissions, then global temperatures are going to rise more. So we need to cut our carbon dioxide emissions by 45% within the next 10 years. And this was, 2 years ago when this came out, and we've got a big job to do. So that's why, whatever opportunities we have in our clinics and, elsewhere, our policies within our healthcare systems or other systems, I just feel like, clinicians are a voice that can lend itself all to that. And that's why Wisconsin Health Professionals for Climate Action is working on so many things related to climate change and health. So this is a very interesting illustration of what just 0.5 degrees Celsius or 0.9 degrees Fahrenheit can make. How much change that means to, well, you can see, extreme heat, which is something we deal with in Wisconsin. And flooding, we deal with a lot. Here this mentions sea level rise. Decline in coral reefs is significant. You can see in the right lower corner. Crop yields is a problem, worldwide, feeding our population as our populations rise. And of course, species loss is huge. So, so it really does make a difference that we get, our carbon emissions down quickly. As a result, New England Journal of Medicine isn't the only one calling climate change or global warming a major public health emergency, but there's an article in USA Today that's illustrated here. Many medical groups are, and as a result, kind of our parent group for the US, the Medical Society Consortium on Climate and Health, which has a number of state groups, including the Wisconsin Health Professional for Climate Action. They put out this US call to action in 2019 and got endorsements by major groups, including my organization, American Academy of Family Practice, and you can read all the groups below. But I'll go through this quickly, what this US call to action policy agenda has in it. First of all, the statement that climate change is a public health emergency. And then has different points, what we need to be doing. I won't read all of these, but a lot of these can come up in our interactions with patients, and I'll tell you how. For example, transportation systems, we can talk to our patients about walking more, using their bikes, things like that. And I'll go into that more as we go. And sustainable food, I'll talk about that more. So just engaging our patients, engaging our health sector, engaging our communities, and looking out for, we know that climate change is happening, but so we have to also look at mitigation and look at how to build that resilience in our communities. And we have to look at our investments. A lot of us, I'm getting close to retirement, and unfortunately, a lot of the things we're invested in are, fossil fuel industries. So, there's a lot we can do yet. This just shows how health professionals are the most trusted voice. Nurses top us as doctor rather than the doctors, but members of commerce are on the bottom. So, and there's a lot of people in between. But we certainly are trusted in terms of what we have to say. But there are lots of barriers. We're really busy, in our clinics. How are we going to talk about all these things? People will say there's not specific guidelines. Well, I'm going to give you some tonight that will be helpful, but we can't give you everything in 15-minute talks. So I'm hoping that you'll continue. This will just continue you on your journey for learning about climate change and how you can talk about it. And there's a lot of political divisiveness. I live in a community where it's more accepted, but maybe some of you live in communities where there's, people aren't as knowledgeable or accepting. You can talk about pollution though. I mean, there's ways of talking about this. So I mentioned previously, food and transportation are places that you can talk about climate change, and also vulnerable health conditions gives you a forum. And you can talk about carbon footprint with your patients too. Some of us, see children, but a lot of us see adults too. And so there's opportunities in all these, encounters to talk about the message of reducing meat and dairy. And we've been talking about it in regard to improving your health. But we can also then add, and it reduces the carbon footprint. Well, what is the carbon footprint? Well, it's, Mr. Jones or whoever we're talking to, that's the amount of carbon that that goes into the air from our human activities, such as when we drive a car. Carbon dioxide comes out and goes into the atmosphere. And then how much we do to increase that carbon footprint really has an impact on our climate. So you can just give simple messages. And you can, talk about food and how much, we'll get into this actually in the next slide a little bit more. Interestingly, greenhouse gases, we know that, that transportation and electricity give out, CO2 and manufacturing, etc. But livestock are a huge portion of that just by, what they, their footprint from production and from, what they put out. Part of that is methane. It's not just CO2, but it's methane is a huge, actually a more potent greenhouse gas than carbon dioxide. And it's mostly what the cows are burping, not pooping. But manure is also a significant source of methane emissions too. Here we are in Wisconsin. I'm picking on the dairy industry, but it is something that we need to face. So enteric fermentation is what's happening in cattle that makes them burp out methane. It's the most significant source of methane above fracking even, which is interesting. When I found that out, I found that very interesting. So it makes a difference what we eat. So if you're a meat lover and you eat a lot of meat, you can see in red that, if you eat beef and lamb a lot, your carbon footprint is going to be a lot higher. If you're more of the average person, it's a little less, and then it goes on and on toward vegan. You may be somewhere in between. You don't necessarily have to be vegan, but the more you become aware and try to come up with other things to eat, the better off our planet is. And this is in gigatons per year, the numbers of carbon emissions or greenhouse gases emitted, not just carbon, but methane. So I just switched to oat milk this year. I like milk and I didn't want to give up milk, and I was like, what am I going to do? So I started drinking oat milk. I got really used to it and I actually like it now. At first I wasn't so sure. But you can see that, as far as greenhouse gas emissions, water use, land use, dairy milk is on top. Soy and oat are on the bottom. Almond is a little higher, but still any of these milks besides dairy is better, and we know that, almond trees use a lot of water in California. Mostly in California is where they're grown. But you can also talk to your patients about transportation, walking and biking and running. We know it improves our health, and, using the bus, other forms of transportation, biking, for transportation. And again, you can say, it decreases the carbon footprint. Do you know what that is? And talk to your patients about it. And so, there's a lot of obesity, a lot of diabetes, and we can start to talk. We see our diabetics at least yearly, if not more often. Even during the typical adult physical, we could talk about these things. And the reason to talk about, biking, Jonathan Patz, who maybe a lot of you know, he's a researcher here at UW and director of global health. He estimated in a study that if we just reduced, some of our trips are trips that, we're not going very far. If we replaced 50% of our auto trips with bicycles, we'd, on the best weather days, we'd save, 51 lives per year, $279 million a year from mortality and reduced healthcare costs. And we're reducing admissions as well. The health benefits and the co-benefits to the planet are immense. So next, I want to talk about those vulnerable conditions that are affected by climate change. So here's our climate change and health slide, basically. So we talked about heat a bit, but also the particulates and the ozone level affect anybody with heart and lung disease. And so we want to talk to our patients about high ozone days and heat index days, because that's going to help with their health. The elderly and other groups, that are in situations where they don't have reliable electricity or air conditioning, we want to talk to those folks and let them know that there are cooling centers if they don't have a place to go, and to seek those out. And then this is a case on the bottom I wanted to talk about. There's a couple of years back when we had a lot of flooding just west of Madison. I saw a guy for a back injury, and it's because he was moving furniture out of his flooded basement. But also we know that flooding causes a lot of mold allergies, and so, you know, a lot of mold in homes, I should say. And if you're allergic to mold, then that's a problem. This is just showing a heat index guide. It gets hot and it gets humid in Wisconsin. And so we, you know, if it's, you know, 91 degrees outside, but the heat index is higher, it's as if it were over 100 degrees. So we need to be more cautious on those days. And then air quality, you can talk about air quality from a number of perspectives, but ozone is one of them. And ozone occurs when we have those high heat days. That's when ozone is made. And so we can talk to our patients about that, about, you know, not being, especially if they're sensitive, not being active outside. And fortunately today I looked at the Air Now website. That's a really good website to look at for what's the current air quality where you live. You can just type in your zip code, and so take note of that, and maybe somebody can put that in the chat box as far as a resource for looking at air quality when you want to talk to your patients about that. So I mentioned a number of things that you can do in your office, but as others have said, being active, you know, with environmental health, we are, because we're passionate, and we hope that you are too. There's lots of things you can do to be a super achiever. I put in make smart phrases. A lot of us are on the EHR. It's hard always to remember everything, you know, when you're talking to patients, and you put something in the patient instructions. You can put something about climate change, you know, about carbon footprint in your patient's instructions. And just being able to recognize when you're seeing a patient for a health issue that there's a relationship to climate change, and then to say something about it. You might want to testify. Here I am, I'm testifying. This is an industry guy next to me. I just thought it was a great picture because he's looking kind of worried. It was, I can't remember which one this was about, but off the top of my head, but anyway, you know, testifying when those opportunities come up. Arranging for a speaker for your healthcare system. We Wisconsin health professionals or Climate Action are trying to talk to healthcare systems about reducing their own carbon footprint. And then joining our group, we'd love to have you involved. Here's just a couple of resources that I mentioned. You know, we've mentioned the groups that sponsored tonight, and then Medical Society Consortium on Climate and Health has got a lot of stuff on their website, so I wanted to bring that up. So hopefully I didn't go too far over. I guess it's right at 8 o'clock.
Yeah, right. So we'll do some questions, just a few. You know, someone had a question about, this is for Beth Neary. What is the prognosis for a third grader that with mercury toxicity? So what is the prognosis for the third grader with mercury?
Okay, as far as that child, I don't know the specifics of what happened. Mercury can be eliminated from the body. So I guess it's really a function of how long the exposure was. If it was, say, prenatally, or a child 0 to 5 when the brain was significantly still developing, it would have a far greater impact. I don't know what happened to that third grader. So it's hard to know.
I know we had a question about arsenic, so I was curious if any of the three of you guys have encountered anything with arsenic in drinking water at all, since it's naturally occurring apparently, or any other chemicals in drinking water that you've seen come up with your patients. Take that as a no, so that's okay. One of the other questions is, you know, so for someone that's not a health professional, for example, like me, like, how do you guys have any suggestions for bringing this up with people?
Can I answer the arsenic question?
Yes, go for it.
I'm just going to answer it this way. So within drinking water in the United States, there are regulated compounds and unregulated compounds. For example, PFAS is currently unregulated, but arsenic is a regulated compound. So in municipal drinking water, they look at it and it is under control, but not so if it's in well water, because well water doesn't have any national drinking water standards.
Yeah, so something I was thinking about was how does, as a patient, do you guys have any recommendations for, as a patient, how to bring this up with our doctors that may not be as forthcoming as you three?
Can you rephrase that question, please?
Yeah, so like, for example, me going into the doctor, how is there anything I can bring up to stimulate conversation to talk about my background that could better inform her and her prognosis of what's happening with me?
So you're saying bringing up your health issues so that the physician can help you?
Yeah, so like maybe the physician, I mean, aren't as forthcoming about talking about these things as you guys are. So if they're not as forthcoming about talking about climate change, do you have any recommendations or anything that would help?
for you to educate the doctor.
Yeah, like a little bit of the opposite.
No, I think, am I being heard?
Yeah, I can hear you, Jed.
If you know of exposures you've had in the process of growing up, did you grow up on a farm? Were you around pesticides? Were you around herbicides? Let them know about that. Let them know that's a concern as you're looking at potential. I don't know if you're planning on it, but I assume you'll potentially have kids and that sort of thing. Let them know that you've had some pre-existing exposures and ask them, they're not going to know the answer, but you can ask them what suggestions they might have. And most of it's going to probably end up just being, well, all you can do is clean up your act. At this point in time, that's water under the bridge. But it's just, we all know that, oh yeah, there's that time my dad made me use something called penta to paint the gate. And, it's a bad thing to be exposed to, but my dad didn't know at the time, and neither did I. So I think that you probably have some awareness of things that might have happened to you. My dad had the greenest lawn in the neighborhood. We were using herbicides all the time. Whatever. So.
Got it. Thank you, Jed. I appreciate it. We do have a question for Dr. Claire Gervais. Could you bring up some more examples of how to implement climate education in patient encounters or addressing patients who are climate change deniers in your encounters?
I don't think I've really gotten that kind of feedback from patients when I brought it up, but I have talked to members of Congress and their staff who are climate deniers, aka Ron Johnson's office. And when we were talking to their office, and I think this bodes well for the office as well, we were focusing on particulate matter when we were talking about coal-fired power plants, just the toxins and that kind of thing, rather than focusing on climate change. And what we also noticed is that things are changing even for the group that was climate deniers are actually coming around to that there is climate change. Things are changing slowly over time. More people are believing that climate change is an issue and that humans are causing it. And so I've noticed that change, which is great to see, so I think you can talk about, ozone levels. You can talk about particulate matter in the atmosphere. You can talk air quality, those kinds of things, and not get into climate change so much if you sense that someone, isn't going to believe that. And you don't have to get into it too much.
So I'd also like to add that, Beth and I talked quite a bit about toxins, but it's very much related to climate change, because as there are bigger weather events, wet is wet, dry is drier. So things like holding ponds for manure don't hold when there are big flood events. And so more toxins get into well water and into groundwater. PFAS leaks more, things go in plumes much further. So all these are really interconnected and really part of a big picture. So, Beth and I talked a lot about toxins. Claire came from the climate perspective, but they are very, very much linked, because climate change changes the way we're exposed.
Can I address one question I'm seeing about plants requiring carbon dioxide to live? I didn't talk a lot about what's happening, in terms of climate change itself and the health effects. But one thing we're seeing is increased pollen counts for plants that we're allergic to. So yeah, certainly plants require carbon dioxide to grow, but we're seeing increased growth of weeds and increased growth of kind of the pollen counts going up and up and up. I have a slide for that and I didn't put it in this show, but we're seeing that it's reaching further north as we go. So there's certainly a lot of impacts, and it's very complicated. It's definitely not simple. And so your point about, yes, definitely plants need carbon dioxide to grow, but we also there's a lot of other impacts like deforestation, for example, so our CO2 level is higher in the atmosphere and causing these issues. We actually do need more plants, but we need, more trees or more croplands, things that take up the CO2 in the atmosphere and not leave it in the atmosphere. So hopefully that answers that a bit.
Appreciate that. So this is actually a question from me. I'm curious, and for those that are watching, I'm not a health professional, but I'm curious about, in prenatal, in pregnancy, and then the beginning of a childhood's life with lead, what happens if your house does have lead? Do you have, just a logistical question, if I'm pregnant and realize the house has lead, is there an immediate action that we could take, or we need to move, kind of thing?
No, you don't need to move. So basically, if you have lead paint and the paint is in good repair, you're good. Okay, you don't have to strip all the lead paint out or anything like that. So
I was just curious about the expense that it could be for someone to
the problem the problem for people who yeah, that's true, the expense, but one of the problems is when somebody decides to renovate and they start moving walls and things like that, and they disturb the lead. So that's a problem. You don't want to do that at this point.
Moreover,
go ahead.
during the process of trying to remove the lead, if you try to do it yourself, you're going to have a huge exposure that's going to be a body burden you're going to carry for a while. And so you're much better off, leaving intact lead in place. You can wash your windowsills and floor with, I think it's high phosphate detergents. And that helps bind the lead to some degree, and you can clean some of it up that way. That's all I remember off the top of my head.
Additionally, Wisconsin has a lead safe homes program, which I'll put the link for in the chat. It actually covers the cost of testing your house if you are low income, and then can also help with the mitigation of whatever exposures your home might have. And so that's a good option if you have patients who are lower income that want to get their house tested.
Do not see any other questions. Last chance if anybody does want to unmute themselves or put in the chat box for questions. I'm not seeing anybody unmute themselves. So let's see. Yep, okay. That's not a question. Thank you, Claire, Susan, and Beth so much. Also, quick shout out to Jed, who's also part of WEN. He's also on our steering committee, and he hopped in for a few answers, which we greatly appreciate that. And thank you to the lovely Abby, who is moderating some things and helping me out. She is the employee at Wisconsin Health Professionals for Climate Action. So she is there, and we've put in all these links as well. And we have some really great websites and resources that we shared with you all, but a good starter point is just to start with the WEN website and the Wisconsin Health Professionals for Climate Action website, or our Facebook pages, which are great. And keep your eye out for the Environmental Health Conference and our amazing speakers that'll be coming in February and March. So once again, thank you, everyone.
Thank you.
Thanks, Anna.
Night.
Thanks, everybody.
Thank you.